Imagine the following scenario. You're driving in your car without a care in the world when suddenly you hear, woo, woo, and you look into your rear view mirror and you see these blue flashing party lights on the top of the car behind you. And then you notice that the driver of the vehicle is wearing a party hat and indicating that you need to pull over because he has a present for you. Now, you don't even bother to look down at your speedometer because you know the needle should be about here, whilst it's actually about here. You know, perhaps you don't even need to imagine this scenario, as it's only all too familiar to you. But imagination required or not, I'm sure that you can identify with the changes that occur almost instantly in your body. That's right, your heart begins to race. You can feel it pounding in your chest. Your palms go all sweaty. Your muscles tense up. You start to breathe erratically, and those butterflies in your tummy go berserk. Don't you hate those feelings? Well, these are all symptoms of what is referred to as the stress response.
Good afternoon, everyone. I love the introduction to this program. I am Dr. Sal. I am the Medical Director for the Lifestyle Medicine Institute and the CHIP program. And I want to welcome everyone to today's program, which is about stress. And I love Dr. Morton's introduction. And I guess in Australia, they actually give out gifts and they have party hats when the cops follow you. It's an interesting place to live. So I'll have to chat with him about that. And the opening music is fabulous. I want to thank Daryl Luddington for all of his technical support. And today's show is about stress. And we started out a little bit this afternoon with a little technical stress, which we did resolve, fortunately, very quickly. But before we actually get into the contents of the show, and before I have the pleasure of introducing our esteemed guests, there are two poll questions. One should be up on the screen right now. How would you rate your stress level on a scale of 1 to 5? So for everybody that's on the line, let's see how stressed or otherwise individuals are today. It certainly looks like the majority of the individuals on the line are stressed. So this is really apropos, given today's climate, for so many reasons why we should be talking about stress. And then we do have a second question. What is the biggest cause of your stress today? And there are 6 choices that'll be there. Is it the pandemic? Is it family issues? Is it work issues? Is it protests and unrest, finances and the economy, or other things? The majority of the people are stressed out because of the pandemic, and obviously so. And again, you know, I mention this every time. We've been dealing with this now for so many months, and my heart goes out to all the individuals that are suffering from this virus, have unfortunately lost people in their family or friends. And our hearts go out as an organization and as a team of people just to say we're with you and we're praying for you. So let's get on to happier things. I'm going to share my screen and have the pleasure of introducing Dr. Lovejoy, Jennifer Lovejoy. And Jennifer is actually the newest member to the Lifestyle Medicine team. She has a PhD in physiological psychology from Emory University. Dr. Lovejoy has dedicated her career to research and the clinical applications of approaches that are involved in the integration of mind and body. And that's such an important thing to talk about. You know, how do we understand the integration of what happens in the body and what happens in the mind? And she's really focused a lot of her work on chronic disease, especially obesity and type 2 diabetes. While Dr. Lovejoy was in academia, she was involved in designing an intensive lifestyle intervention program for the DPP, for the Diabetes Prevention Program. And that's really interesting because they ultimately found that they were able to reduce the onset of diabetes by 58%. So what we do in lifestyle medicine today is just so extremely important. And then subsequent to that, she designed and implemented a successful lifestyle and behavioral intervention program for weight loss and personal wellness for 2 healthcare companies. Dr. Lovejoy is currently the VP of Innovation and Program Strategy for the Lifestyle Medicine Institute. So I welcome you today to the show and thank you so much for your time. So we have some questions and we're going to get into the topics of discussion today. And I'm really going to turn the floor over to you for most of the program. What do we know about the impact of this coronavirus on mental health? Because obviously, as we saw from the poll, we have the majority of people really being stressed out because of that. So how is that impacting mental health?
Yeah, that's exactly right. I think the poll was very telling, and I can reassure, I guess, our audience that they're not alone in this. So concerns about the impact of not just the disease, the COVID-19 itself, but also the lockdowns, the social isolation, all the things that go along with it, have been a big concern of physicians and scientists since the pandemic began. And so lots of research has been going on looking at mental health. I actually thought I might show a couple slides. Daryl, if you could pull up the first slide, I'll just give you a little bit of indication of some of the results that have been found in terms of mental health. These are some data from the Kaiser Family Foundation, which is a nonprofit foundation that looks at health across the board, physical health and mental health. And they've published a lot of interesting data on mental health in the US as a result of the pandemic. But what this is showing is a couple different things. So they looked at both symptoms of anxiety and symptoms of depression. And to make it onto this graph, you had to be reporting that you were experiencing those symptoms more than half the days or nearly every day during the week. So these are people who really are struggling. And what you can see are data from May, June, and July. And they tell us a couple things. The lighter blue bars on the left are anxiety, in the middle is depression, and the dark blue bars are the combination. So those are the easiest ones to look at. And so one thing you immediately see is that going from May to June to July, things are actually getting worse. The people who are experiencing some degree of anxiety and depression is continuing. It's gone from about 34.5% in May up to 40%. So, really high numbers, 1 in 3, 1 in 2 almost, that are experiencing some fairly significant anxiety or depression as a result of the pandemic. And, but what is the context for this? And that's where the next slide, I think, is really interesting, because to get a sense of how things may have changed, and there's not a whole lot of data on this, but this study that I found actually had survey data that compared 2018 to 2020. So they were able to directly see what, and in this case, it was a different measure of psychological distress in adults age 18. And you can see in the very top that 14% versus 4% reported symptoms of serious psychological distress in April of 2020 compared to April of 2018. So, almost a tripling, more than a tripling of the number of people reporting that. And to your other question, Dr. Sal, about, does it affect some people more than others? What this graph shows is yeah, it clearly does. If you look at age groups, which are about halfway down, and the 18 to 29-year-olds, you can see that their psychological distress in April 2020 was almost up to 25%. 1 in 4 younger adults experienced serious psychological distress, which probably makes sense. I mean, these are the college students that are just graduating, the folks who are, really just beginning their careers and their lives, and everything has been upended, everything is uncertain. And so a lot of distress there. You'll also see that there are ethnic differences. Hispanic populations, who we know are disproportionately affected by the virus, are showing higher levels of distress. And also, not surprisingly, people with lower income. We know the financial impact of this has been really hard. So these are just some concrete numbers to say, yes, the mental health effects of this pandemic are real and are definitely impacting a large proportion of our population, some more than others. The other group I'll just touch on, because I know we have healthcare providers on the line with us today, and healthcare providers are a uniquely vulnerable population right now. So we know that because of the stress of caring for patients with COVID, worrying about their own loved ones potentially being exposed, a number of studies have shown that the rates of depression, anxiety, insomnia, PTSD in healthcare providers are actually even higher than in the general population. So, so there's definitely some things here to be aware of, to be cognizant, and then to bring in the stress management skills to try to deal with.
Right, that's so true. I mean, that for the healthcare providers that are on the line, making sure that you're taking care of yourselves. It's really amazing how well healthcare providers take care of other people and oftentimes neglect their own health. But what's really also interesting in that category is the fact that, as a healthcare provider, if you see someone all of a sudden coming in with uncontrolled high blood pressure or their eating is out of control. Not everybody walks in the office and says, hey, I'm stressed, hey, I'm depressed. They may have something else going on health-wise, and you really have to sit and figure out what is it that's really happening with their individual and really start to broach the conversation. Is something happening in life that's really causing you to be stressed out? Are you depressed? So really getting to the root of the problem, which in lifestyle medicine we always talk about. So that's really important. And then, why is the pandemic so harmful? Why has it been so harmful for the mental health of the population? Because, when you think about it, we've only been dealing with this for 6 months. And I say that obviously tongue in cheek, but, it's something to really think about. Why has this been such a difficult problem for people?
Yeah, well, I think it is because there's sort of a double whammy, right? There's the pandemic itself, and people are understandably afraid of the disease. It's a terrible disease, as everyone knows. It is life-threatening and highly contagious, and so there's natural fear around that. But then there are also all the public health measures that we've taken to try to control the spread of the disease and to protect ourselves, and that includes things like the lockdowns, the social isolation, social distancing, the economic impacts of the lockdown. So it was almost like we had the baseline effect of the pandemic, but then some studies have shown that in fact the social isolation and lockdowns and the financial impact, are having equally as much of an effect on mental health. So it's kind of a double whammy. And, and I just have to acknowledge too, today, the, folks who are currently being impacted by Hurricane Sally, which is a big deal. Here I live in Seattle, and we were having all across the West Coast, of course, the terrible wildfires. And so, it's been a heck of a year. There's a lot of reasons to be stressed beyond the pandemic and the social distancing and everything else. So again, I love that we're going to be talking about stress management because it's something we all need to be diligently practicing right now to just keep ourselves calm and healthy.
Right. And, so much about stress in and of itself is how you react to it. And I always think, and Darren brought this up on his little video clip, when you're driving in your car and someone cuts you off, you have different ways that you can respond to that individual. You could, give them all sorts of crazy signs and, verbalizations, or you can just slow down, say a prayer, hope that nobody gets into an accident. So it's also how you respond to the stress that really makes a difference. Most commonly reported sources of stress, I know that you're going to talk about that. I think it's important for us to realize why we're having all of these impacts, maybe you can give the audience a little more clarity on that.
Yeah, so this was an interesting study that looked sort of qualitatively at what were people reporting as sources of stress in the pandemic. And this also ties into some of the things that we can do to actually protect ourselves. So the most common reported source of stress was actually hearing about COVID-19. Not surprisingly, 96% of people said just watching the news, reading stories, listening to the radio, hearing about how severe it was in and of itself stressful. So, the flip side of that is you got to watch your news consumption, right? You got to control how much of that you're actually being exposed to. And we'll talk later about how, just controlling what you can of stress is really important. So that was a big one. Uncertainty about the future. We humans do not like uncertainty. It's not something we deal well with. We like to plan. We like to see things that are, going to happen. And this has clearly shown us that there is a tremendous amount of uncertainty, and we still don't know what's going to happen. What's going to happen with schools? What's going to happen with sports? What's going to happen with all of these things? Living with uncertainty is very high. And then, the fear of infection, the finances, the things we've already touched upon are also really big stressors for people. So again, it gets to that multifaceted things are really causing stress in this pandemic.
And again, it's really the way you think about that. So we can control the future to a degree with the choices that we make. And I think certainly in the CHIP program and in lifestyle medicine programs in general, we talk about making the right choices so that you can have more control of the future and what happens on a day-to-day basis, and really doing something with your routines. For the first 3 months of the pandemic, I was at home doing telehealth for 12 hours a day, 7 days a week, and it was crazy. So you can either decide that you're going to go crazy, or you could decide that every hour I'm going to do some calisthenics at home. I'm going to go take a walk real quickly and do simple things that can de-stress yourself, which is such an important thing. And again, in lifestyle medicine, we talk about the 6 pillars of lifestyle medicine. So why is it that stress management is even one of the pillars?
Well, stress has such a tremendous impact really on the whole body. And we know, and you've already brought this up, that it can impact our blood pressure. It increases risk for heart disease, for diabetes. It can cause weight gain, particularly weight gain around the abdomen, which is the most unhealthy type of body fat to carry, the mental health effects. So headaches, backaches, you name it. All of these unpleasant symptoms of stress are important. But I think the one we really want to focus on, and I think we have a video clip on that, is the effect on the immune system. Because here we are in the middle of the pandemic, we want to do everything we possibly can to keep our immune system in top function, top order. And if we are experiencing chronic stress and not managing it effectively, one of the big things that's going to affect is our immune system. So
we're going to look at a clip next.
Stress can also powerfully affect our immune system. Indeed, it's now well established that cortisol, which is the main stress hormone produced during the stress response, inhibits the immune system. You think about it from the body's perspective. When you are out running that bear, hopefully, your body isn't interested in anything other than supplying the nutrients that the muscles that are doing the running require. Digesting stuff? Worry about it later, it says. Healing? Not now. Just run. Now, this lack of attention to healing does not present a concern if the stress response only lasts for a few minutes. But as I indicated earlier, when it remains activated, even just at low levels, for days, weeks, months and years, it becomes a big problem. It's well documented, for instance, that your stress levels can influence the likelihood of you getting sick. Studies have shown that when volunteers are inoculated with a cold virus, and I have no idea who puts their hands up for these experiments, probably needy college students. But anyway, the researchers find that the best predictor of whether the individual will develop the cold symptoms or not is the number and the severity of the stresses they have faced over the previous month. And if you're unwell, your stress levels and psychological state will influence how long it takes to get better. Higher levels of distress and fear prior to surgery is associated with poorer outcomes in terms of longer hospital stays, more post-operative complications, and higher rates of rehospitalisation.
So that's interesting, and I don't want to add another stressor to the mix, but it's something that I thought about when I was having a conversation with someone the other day about the microbiome. I think over the at least a short time period as a result of this pandemic, our microbiome and the diversity of the microbiome is going to change because we're sanitizing everything. We're staying away from people, so we don't have that physical contact anymore. And when you have physical contact with people, you actually share bacteria. So I think this is something to think about going forward. How do we really start to adjust to the changes that will come about as a result of this pandemic? How do we strengthen our immune system so that we can deal with the next one that comes along? And then really, what are the strategies for managing stress and really building that resilience that we need?
Yep. Yeah. And that's an interesting point about the microbiome too, because of course, stress itself impacts the microbiome and can be associated with inflammation. So we want to do everything we can to kind of keep that gut-brain connection healthy. So I'd love to talk about what can we do, right? We know the problem. And so, CHIP makes some really good recommendations about controlling stress. And they kind of fall into two categories. The first is to really take less stress on if you can. And that goes back to the earlier comment I made about, maybe limit the times during the day when you watch the news. I caught myself compulsively checking the air quality here in Seattle lately because it's so bad. And it's like, no, I need to stop doing that because every time I look at it, it makes me stressed that the air quality is very unhealthy or whatever. And so, just taking control of our habits like that and trying to reduce stress, figuring out what's in our control and what isn't in our control. As you were saying, Dr. Sal, looking at, our own reaction to things and can we choose to have a different reaction? And then there's practicing regular stress management techniques. And I'm always amazed how many people actually don't regularly have a practice. It's almost like we wait for the stress to hit and then we go, oh my gosh, I better do some stress management. There was one famous stress teacher who says, a stress management teacher that said, that's sort of like waiting to start sewing your parachute when it's time to jump out of the plane. And
Right.
is you want to actually be practicing regular stress management strategies, ideally before things become stressful. So, many of them: exercise, meditation, deep breathing, mindfulness. I mean, there's lots of great practices, but find one that resonates with you, and then, really make sure that you are building it into your daily routine, setting up a habit to do that. And that's especially important now. It's never too late to start, but, sew that parachute now if you haven't already done that. But what I wanted to talk about today are actually two things that are not covered in CHIP yet, and that I think could be really relevant for the pandemic. And the first is to acknowledge what is called our brain's negativity bias. And so what that means is that we have basically evolved to look for negative things in the environment. It's just the way our brain works. And if you think about it, that's a pretty important thing for our brain to do, because you want to see threats. If we were, back in our Paleolithic days and there was a tiger chasing us, or a bear, like Darren said in the video, you want to see that tiger or that bear, and you want to be able to take action against it. So the brain is really, really good at seeing the negative. We see the positive, it's kind of like, yeah, okay, no threat there. We're not going to, really do anything about that. And so it's been described as like the brain is Velcro for the negative and Teflon for the positive. The positive tends to slide off. And so we are clearly surrounded right now with negativity, right? We've got the pandemic, we've got the violence and the unrest, we've got the economy, we've got, the upcoming election, whatever your politics are, there's stress around that. What's it going to happen and how's it going to go? So we have to be very diligent about looking for the positive throughout our day, and finding those little things, keep a gratitude journal, or, really find ways to either create or notice positive. Beautiful flower is blooming, the sun is shining in the sky, whatever it might be. And the key, and this is something I highly recommend, a book called Resilient by a psychologist named Rick Hansen, and he talks about all of this, that it's not enough, because our brain's negativity bias is so strong. You can't just notice the positive stuff. You really have to work to take it in. So, if I notice that something really good is happening, maybe my daughter comes and gives me a big hug, rather than going, okay, that's great, and move on. It's like, no, sit with that for like 30 seconds, a minute, really take it in, that positive, good feeling. And that over time will literally be building new connections in your brain to help you notice more and more of the positive, which makes you feel better and better, which makes you more resilient. So it's a really good strategy to use to build resilience over time. And it's easy to do and fun to do, really. So that's strategy number one.
I love that.
Strategy number two, and many people do this anyway, but I think perhaps don't appreciate what a powerful technique it is, and that's deep breathing. So when we take a deep breath, and to define that, it means your stomach has to move. You cannot just take a deep breath up here in your chest. You actually have to have your belly move in and out as you inhale and exhale. And that's because you are stimulating the vagus nerve, which is a major nerve. It comes from the brain, it travels down through the neck and through the torso, through the diaphragm. And so when you're breathing in and out and your diaphragm is moving, you're actually stimulating the vagus nerve. Why does that matter? Because the vagus nerve is what basically controls our fight or flight response, takes us into that fight or flight response, which is the chronic stress, or what's called rest and digest, the parasympathetic nervous system, where we can be calm, our blood pressure comes down, our heart rate comes down. And so we can use that deep breathing, and particularly focusing on the exhale. So a technique is take a deep breath into 4 and then blow out for 8 counts. In for 4 counts, out for 8 counts. Really helps to turn on that parasympathetic rest and digest nervous system, to put us in a calmer state and to lower our blood pressure. So those are just 2 really key techniques that I think, again, easy to do, can be done anywhere, and are helpful for people to managing their stress.
Oh, those are fabulous suggestions, you know, and again, for all the facilitators that are on the line, for all the healthcare workers, these are two simple things that we can all do for ourselves, with our family, for the people that are involved in CHIP. And really, when you look at that as being integrated into the CHIP program, you can see how valuable this program is to help people with so many different aspects of their lives. We've talked about this in the past. You know, CHIP is not a nutrition program. It is a lifestyle medicine solution to so many of the chronic illnesses that we deal with on a regular basis. And as you mentioned before, you know, we could either look at the positives or the negatives. So is my glass half full or half empty? I mean, that really thought is very important to think about. And I think that's a great suggestion that you just mentioned. Sometimes we think that, you know, somebody gives us a quick hug and it's like, okay, fine, pat them on the back and they go away. But really helping those positive aspects of life really sink in. That was a beautiful suggestion. And I always tell my patients, you know, count your blessings before your money. There's always somebody that has life much worse than you. We're seeing so many people on the streets today that are homeless, and they're out there with their cardboard boxes and signs. So we really have to reach out to other people and try and help people. I tell my daughter this: help somebody before they even ask for help. Keep your eyes open so that you can relieve somebody else's stress. We have a few questions on the line. Thank you, Maddie, for this question. Whether at home or at work, how do you handle the stress that is caused from other people who are lashing out because of their stress?
That's a great question. And boy, are we seeing that, right? You know, I think it's a hard question to answer. What I really just try to practice is compassion and understanding that if people are lashing out, it's because they're suffering. It's because they're scared. It's because they themselves are stressed and maybe feeling overwhelmed. So, you know, depending on your relationship with the person, if it's someone you know pretty well, you can even reflect that to them. Just say, you know, hey, it seems like maybe you're kind of stressed out. Is there, you know, anything, I mean, to your point, Sal, is there anything we can do to help with that? If it's someone like just in a store, a stranger, you know, a clerk or something, then, you know, sometimes just giving a smile and saying, have a nice day.
Right, exactly.
Really, but boy, I just, like you said, my heart just goes out to the people who are really, really suffering. And that lashing out is a symptom of that suffering. So
Absolutely.
I can remember that, which isn't always, but I try to remember that it's just that they're having a hard time.
Yeah, I would do that with the people that work in our front end with patients coming in, and oftentimes they're not in the best mood, if you will. And I always remind them, they're the ones that are sick. You know, they're the ones that are coming in because of a problem. Let's be cognizant of that and try to be more kind if we can. A few people are asking, what was the name of the book that you mentioned?
Yeah, it's called Resilient, and the author is Rick Hanson, Hanson.
Okay, Resilient by Rick Hanson. What evidence is there that all the negative comments on Facebook, social media is not good for us? Is it difficult to ignore this? Yeah, turn the thing off, really.
Yeah, no, thanks for bringing that up. Actually, I meant to mention that when I was talking about the news media, because social media for so many of us is even a bigger source of those stressors than news. And so, yeah, I mean, deliberately limiting your time that you spend on social media. There's lots of data. Much of it is in younger people, you know, children and younger adults, but there's a fair amount now emerging in people of all ages that social media does not improve our mood. It is stressful. No. It makes us feel inferior, and that makes us feel depressed and anxious and diminishes our self-worth. So I think using it in a very, in a limited way. And, you know, obviously if there are people who are posting and that's really disturbing to you, you may want to think about keeping them, you know,
unfriending them. Right. Yes, actually somebody responded to Maddie's comments. You know, for the people that are in your life that are chronically complaining and really having a negative impact on you. And I've told many of my patients this, you know, sometimes you need to get new friends. You need to unfriend people on Facebook and stop looking at social media constantly, which so many people do. And you have to really be sure that you surround yourself with people and situations and environments that really lift you up and help you to make things more positive. What age would you recommend kids have a social media account? That's a good question.
Oh, that is a good question. I don't know, Sal, what would you say? I mean,
I think it would depend on the maturity of the kid. You know, I mean, there are so many things. I was talking to my daughter about it today because she's friends with a few people that are supposedly kids online, and you know, they chat with one another. And I really try to make her understand they're not necessarily always kids that are behind the scenes, if you will. I think you have to really be very careful about educating your kids as to what social media really is all about. There's a lot of great things that have come about in the last 10, 15 years with our ability to connect with people all over the world, but there's a lot of things that we have to be concerned about. So I think it depends on the maturity of the kid.
and as a parent, you have to monitor it, right?
Absolutely, without a doubt.
The younger the child, the more important it is that you are actually looking at everything that is going on, so that you can detect when there's an issue.
Right now, even political discussions with family can be stressful, and particularly right when you're on different sides of the fence. I'll let you answer that one. How do you deal with the differences in politics when you're sitting with your family?
You know, it is tricky. We are, you know, clearly as a society, we are so entrenched in polar opposites, and you know, people are not willing to change their minds. And, you know, I think that one strategy that I have seen sometimes work, it just depends on the person and how entrenched they are. But, you know, really working to understand their point of view and find the commonality. You know, in the end, there is a commonality at the root of all of it, right? We're all human beings. We all want the same thing. We want safety. We want security. We want well-being, you know, all of that. So, you know, looking for that, it can be hard to find sometimes, but you know, even inquiring, so why do you think that, you know, what's at the root of that, instead of just immediately going, you know, well, I think you know, occasionally, again, it depends on the people, but that can sometimes disrupt us. Again, try to find that common humanity. I think there's so much about this pandemic. If there is a silver lining to the pandemic, and I think, you know, there are some, telehealth being one that you mentioned, but you know, it's that we're seeing our common humanity a lot more, and even some of the racial unrest that's happening right now is because recognizing, wow, you know, things have been happening that, you know, we're all here on this planet together, and we got to find ways to get along. So I hope that there will at least be a bright spot with that in helping to resolve some of this polarization that has certainly plagued us for a number of years before the pandemic even.
All right, Kathy says agree to disagree, which I agree with. I think sometimes you have to do that. And Joe says I would recommend the movie Social Dilemma on Netflix. It made me want to delete my accounts. Well, I didn't delete all the accounts. I did turn off the notifications, and I'm much happier now. So that's good. You know, limit the amount of things in your life that are causing stress, for sure. I watched last night, excellent docudrama. Okay, good. So no, I don't see any other questions, and we're about 5 minutes over, but this has really been so good. I really appreciate your time and your expertise. And for the individuals on the line that haven't seen all the live shows, we do have a link to the shows that are recorded, so you can always go back and watch those. Darren Morton is actually going to be our next guest on next week, Fix How You Feel. And Darren is just so entertaining for people that have not listened to him. He's also a great speaker, really good guy to listen to. So that'll be another great show. But Dr. Lovejoy, any closing comments before we let everybody go and have a de-stress day?
A de-stress day. No, I think, you know, look for the positive, embrace the positive, and we're all going to get through this. It will happen, but you know, there's no doubt we're in a tough time. So be gentle with yourself.
All right, and I want to reiterate again, you know, the CHIP program, and we've been doing CHIP now for about 10 years in my previous practice and now in the new practice. It is such a great program, and if you really focus on this as a lifestyle solution, because the majority of the chronic illnesses that we deal with, including stress, are born from the society that we live in, from the surroundings that we have to deal with, from the way we conduct our own lives. So really look at the 6 pillars very closely, and we're discussing them all, you know, one at a time, as really useful tools to make your life better, to make your family's life better, your friends, your patients, so on and so forth. So I want to applaud everybody that's on the line, that's taking time out of their busy schedules to be involved with us. If there's anything that we can do as a team, the Lifestyle Medicine Institute team of people and the CHIP facilitators and such, please reach out to us. Our contact information is on the last slide. And thank you again, Dr. Lovejoy, for all your time. Really are blessed to have you. And thank you everyone for being on the line. God bless you all. Good afternoon.